Hi, my name is Aide Balcazar and I will be doing my physical exam on Kane. Kane is a 2-year-old male neutered schnauzer who is a house pet. He's bright, alert, responsive, pretty happy puppy. While we are doing our distance exams, you want to take notice of any hunching in the back or signs of weakness in the back legs, which he doesn't have. His stance is pretty normal. You also can take a look at the chest and count the number of expansions to get his rest rate. We will count for 15 seconds and multiply it by 4. So I'm getting 8 expansions. 8 times 4 is 32. So he is in the normal range because it is between 18 and 34. When you do your physical exam, you do want to start from the nose and down to the tip of the tail. So let's start his exam on his face. We'll start at the top of his head and assess for symmetry, any signs of pain, any heat. His head is symmetrical. Move down to the mastocytoid muscles. Normal, there's no heat, there's no pain. Pretty comfortable when I palpate it. And then we will do the mandibular lymph nodes, which are cranial to the salivary glands. You want to do both of them at the same time to assess any differences. They're both normal, they're soft, they're not painful, there's no heat. I will do his eyes. You want to flip over the conjunctiva to look for any discharge, any redness. There's no discharge, there's no redness. And then I'm going to retropulse the eye and assess his nictitated membrane, which is normal. And do the same with the other eye. Normal. His eye position is normal. Their pupils are centrally located. There's no nystagmus or strabismus, so his eyes are normal. Then we're going to move down to his nose, assess for symmetry. He's got a pretty symmetrical nose. It's moist. There is no nasal discharge. Moving down to the mouth, we are going to look at the color of his gums and the texture. Color is pink. He's moist. We're going to assess the CRT by pressing into the gums and counting how many seconds it takes for the blood to come back. It was about 2 seconds. Looking at his dentation, we're going to assess for any broken teeth, any calculus, any halitosis. No broken teeth. All teeth are there. He does have a little bit of calculus here on the canine and on the molar. Let's look at the other side. Same calculus on the canine and the molar. We're going to assess his gag reflex and the symmetry of his tongue by holding the muzzle and pulling down. Gag reflex, normal tongue. Then we are going to assess his ears, look for any exudate, any strange smells, any thickness, any redness, any debris. Normal, no strange smells, no debris, no thickness, no redness, no heat. We're going to move down to the neck, flip his hair in the opposite direction to look for any external parasites. Feel the muscles of his neck, make sure there's no redness, no pain, no signs of atrophy. Pretty normal. We're going to test his range of motion by rotating his head left and right. Down and up. Pretty normal. While we're in this region, you can assess the prescapular lymph nodes, which are located cranial to the scapula. They're both normal. We're going to move over to the thorax. Again, we're going to flip the hair in the opposite direction to look for any ectoparasites, any dryness of the skin, any masses, any lumps, any bumps, or anything like that, which he doesn't have. While we have him in this position, we can listen to the tricuspid, which is in the right side of the animal, and then you want to line out your lung field, which is your triceps, your apaxial, and your last rib, and listen to the 4 quadrants. While you're also listening at the tricuspid, you do want to assess his femoral artery pulse and make sure that those are synchronous. So I'm going to listen to his heart, his lungs, and assess his peripheral artery. I have his heart. Now I'm going to feel the peripherals. Count for 15 seconds. So I'm getting 20, meaning 20 times 4 is 80. His heart rate is in the good range because it is between 70 and 120 for a dog his size. Now I'm going to listen to his lungs. Good lung sounds, no harsh movement of air, no wheezing. His peripheral pulses and his heartbeat were synchronous. They were strong. Now we are going to move down to the legs or forelimbs. You do want to start at the distal end by extending and flexing each toe and each joint moving proximal. Good range of motion here. No sign of pain, no atrophy. Let's move over to the left side. While we are on the left side, we listen to the pulmonary, aortic, and mitral valves, and then assess the limbs distally, moving proximal. Pulmonary, aortic, mitral. His heart sounds are good. There's no murmur, there's no bounding sounds, there's no arrhythmias. Again, now we're going to go ahead and lay out our landmarks for our lung fields, which is triceps, apaxials, last rib, and listen to the 4 quadrants. Sounds good, no wheezing, no harsh sounds. You also want to take a listen to the trachea and listen for any harsh sounds, wheezing. We have good movement of air, no wheezing, no harsh sounds. In this area, we also have the axillary lymph nodes, which are sometimes hard to feel. So I'm gonna take a feel and see if I can find those on Kane. Again, you want to do both of them at the same time. They are not palpable on Kane. We're going to test his proprioception now that we have assessed that his forelimbs are normal. There's no muscular atrophy. So testing proprioception, you do want to flip the paw inward or caudally and see if he can flip it back, which he can. Hydration status is good. Good skin turgor. Bounces right back. Moving down to the lumbar region. Again, you want to flip the hair back. Make sure there's no ectoparasites, any dryness or flaking of the skin, which he doesn't have. You can also assess any signs of tension in the back by putting some support under the abdomen and palpating down his spine. As you can tell, there is a little bit of tension around this area. Seems to flinch every time I have a press it. We are going to take a look or feel his inguinal lymph nodes, which are normal. They're small, soft. We're gonna take a look at his undercarriage or abdomen, inguinal area. Make sure looks normal, that there's no signs of external parasites, redness, or anything of that nature. His abdomen looks good. We're gonna start palpating with 2 hands, starting cranially and moving caudally. We're looking for any enlarged organs, any pain, any distension, any masses. Pretty comfortable when I palpate it, so I would say that his belly is normal. I'm gonna move down to his legs. Again, you do want to start distally and move proximal by flexing and extending each toe and each joint. Little crepitus in the stifles. Musculature is normal. No atrophy, no pain, no heat, no masses. Moving over to the other side, we are going to go ahead and do the same thing. Starting distally and moving our way proximal. Each joint. Some crepitus again in this stifle. And then the musculature feels good. There's no signs of atrophy, no weakness, no lumps or bumps. While we're here, we do want to take a look at the popliteal lymph nodes, which are the most caudal lymph nodes and are located in the hind legs. Those are normal. We're gonna test them and feel them both at the same time. Also, while we have done our forelimb exam, you do want to test for proprioception. So flip the foot. Into the other one. So good proprioception on both. And then last but not least, we want to go ahead and assess his tail. There is a little bit of tension, so it's not flaccid. He's not painful. There's no signs of skin infections or ectoparasites. His anus looks good. There's no staining, no signs of abscesses or anal gland issues. And then I think we are pretty complete with Kane's exam. Some significant findings that I had is some crepitus in the stifle joints, and then in the carpal joints of the forelimbs. A little bit overweight, so his body condition score was a 6 out of 9, so we can address his weight. And then some dental calculus on his canines and molars. But other than that, I think Kane is a happy puppy with normal stance, and he's bright, alert, and responsive.